Don't vape in public places. Big cause. Here are some of the contents I'm going to be reviewing. Hey everyone, today we're discussing a serious issue, vaping in public places, and a major consequence that come with it. This isn't just about personal choice. It affects the people around you in ways you might not realize. It's time to have an honest conversation about why this matters. Before we begin, make sure to like, subscribe, and drop your thought in the comments below. And don't forget to hit that bell icon so you never miss an important update. What is the biggest problem with vaping? Health risks of vaping and nicotine. Number 1. Harm to the heart and brain. Nicotine and other chemicals in e-liquids can negatively impact both the heart and brain. These substances can lead to increased heart rate, higher blood pressure, and reduced oxygen flow to vital organs. Second, effects on brain development. Nicotine can interfere with brain growth, especially in teenagers and young adults. It may affect memory, concentration, learning abilities, and impulse control. Number 3, on the cardiovascular system. Nicotine can narrow arteries, reducing blood flow and increasing the risk of heart diseases and strokes. It also raises blood pressure, pulling extra strain on the heart. Last but not least, evil eye, a severe lung disease. Evil eye, e-cigarette or vaping product use associated lung injury, is a serious lung condition caused by vaping. It can lead to coughing, chest pain, shortness of breath, and lung damage. In severe cases, it may require hospitalization and even be life-threatening. What are the dangers of vaping around others? Exposures to secondhand vaping. Limited evidence. There is not enough research to confirm whether being around someone who vapes, passive vaping, exposes non-vapers to nicotine. However, one study found that spending 1 hour in a space with secondhand cigarette smoke and exhaled vape aerosols led to similar increases in cotinine levels, a marker that shows nicotine exposure in the body. This suggests that being near someone who vapes might expose others to nicotine, just like secondhand smoke from regular cigarettes does. But more research is needed to confirm the risks. Why is vaping not allowed indoors? The impact of vaping indoors. Secondhand exposures to harmful chemicals. Vaping indoors can release harmful aerosols into the air, which may be inhaled by others in the household. These aerosols can contain nicotine, heavy metals, and other toxic substances that may pose health risks, especially for children, pregnant women, and people with respiratory issues. Increased indoor air pollution. Using e-cigarettes inside the house can lower indoor air quality, making the air less clean and healthy to breathe. The chemicals from vape aerosols can linger in the air, settling on furniture, walls, and other surfaces over time. Higher levels of particulate matter. Vaping increases the amount of tiny particles, particulate matter, in the air, which can be harmful when inhaled. These particles can enter the lungs and bloodstream, potentially causing respiratory issues and other health problems over time. Why are vapes bad for the environment? Environmental impacts of vaping products. Toxic chemicals and batteries. Vapes contain hazardous materials such as lithium batteries and toxic chemicals. When these products are improperly disposed of, the chemicals and batteries can leak into the soil and water, causing pollution. This can damage ecosystems, harm wildlife, and affect the quality of water and land. Plastic waste. Vapes are made with non biodegradable plastic parts, which don't break down naturally over time. This means that once discarded, these plastics contribute to growing plastic pollution, harming wildlife and filling landfills. Environmental costs of manufacturing. The process of making vaping products itself has an environmental impact. Manufacturing involves using energy, raw materials, and chemicals that can lead to air pollution, carbon emissions, and other negative environmental effects. In summary, vaping products harm the environment not just through waste and pollution, but also during their production and disposal. Would you like me to go deeper into any of these points? What are three dangers of vaping? Other potential harms of e-cigarette. Number 1, nicotine and brain development. Nicotine is highly addictive substance that can negatively affect brain development, especially in adolescents and young adults. It can interfere with areas of the brain responsible for learning, memory, attention, and decision making, leading to long-term effects on mental function. Second, cancer-causing chemicals. E-cigarettes can release carcinogenic chemicals, substances that cause cancer, including compounds like formaldehyde and acrolein. These chemicals, when inhaled, can increase the risk of developing cancer, especially lung and respiratory cancers. Number 3, heavy metals. E-cigarettes vapor can contain toxic heavy metals such as nickel, tin, and lead. These metals can leach from the heating coils in the device and are harmful when inhaled, as they can accumulate in the body and damage organs, particularly the lung and kidneys. Number 4, tiny particles in the lungs. E-cigarette vapor also contains tiny particles that are small enough to be inhaled deeply into the lungs. These particles can cause irritation and inflammation in the respiratory system and may contribute to lung disease like chronic bronchitis or asthma. Volatile organic compound VOCs. VOCs are a group of chemicals that evaporate into the air and can be found in e-cigarette vapor. When inhaled, these compounds can lead to respiratory irritation and may cause long-term effects on lung health. Some VOCs are also linked to cancer and heart disease. In short, e-cigarettes pose a range of health risks due to their toxic chemicals, heavy metals, and addictive substances, all of which can harm the body in different ways. Would you like to explore any of these risks further? How long does vape smoke stay in the air? Vape smoke behavior. In open spaces, vape smoke dis- dissipates quickly, typically within seconds to a few minutes, as the vapor mixes with the air. In closed spaces, in areas with poor ventilation, vape smoke can linger longer because the vapor particles don't disperse as quickly, leading to longer exposure to harmful chemicals. The vapor can also settle on surfaces and remain in the air for hours. Is vape worse than smoking? Vaping versus smoking. Vaping is considered less harmful than smoking because it doesn't involve burning tobacco, which creates many toxic chemicals. However, it's still not safe. E-cigarettes heat nicotine, flavorings, and other chemicals to create a vapor. While cigarettes contain 7,000 chemicals, many of which are toxic, e-cigarettes still release harmful substances like nicotine, formaldehyde, heavy metal, and toxic flavoring. Vaping isn't risk-free and still poses health hazards, especially because of nicotine and other chemicals in the aerosol. What does vaping do to your brain? Vaping can harm your brain, especially in young people. Nicotine is addictive, leading to dependency. It can also cause mood disorders like anxiety and depression. Additionally, nicotine affects the parts of the brain responsible for learning, memory, and attention, making it harder to focus and learn new information over time. This can lead to long term cognitive issues. Can your lungs heal from vaping? Yes, your lungs can heal from some of the damage caused by vaping, but the recovery depends on the extent of the damage. If the damage is mild or temporary, like irritation or inflammation, your lungs may recover over time after stopping vaping. However, if there has been long term damage or conditions like chronic bronchitis or scarring, the healing process may be slower, and some damage could be permanent. The sooner you quit vaping, the better the chances for recovery. What do vapes do to your body? Vaping harms various parts of your body. Lungs. It can cause inflammation, respiratory issues, and long term damage like chronic bronchitis. Brain. Nicotine affects brain development, impairing memory, learning, and increasing the risk of mood disorders. Skin. Vaping can cause dryness, irritation, and premature aging. Heart. Nicotine raises blood pressure, increases heart rate, and can lead to heart disease. In short, vaping negatively affects your lungs, brain, skin, and heart. How many puffs of vape is equal to a cigarette? Here's a breakdown of the comparison between vaping and smoking. Nicotine content in a cigarette. A traditional cigarette contains about 1 to 2 milligrams of nicotine. This nicotine is absorbed by the body as the cigarette is smoked. Nicotine content in a vape puff. Each puff from an e-cigarette typically delivers about zero point zero 0.08 milligrams of nicotine. How many puffs is equal to one cigarette? To match the nicotine content of one cigarette, which is 1 to 2 milligrams, it would take approximately 12 to 25 puffs from a vape. 12 puffs would provide around 0.96 milligrams of nicotine. 25 puffs would provide about 2 milligrams of nicotine. This comparison shows that vaping can deliver nicotine at a similar rate to smoking, depending on how many puffs are taken. Is vaping bad for your teeth? Vaping can harm your oral health in several ways. Tooth decay. The chemicals in e-cigarette vapor can lead to dry mouth, which reduces the flow of saliva. Saliva helps protect teeth from decay of neutralizing acids and washing away food particles. Without enough saliva, the risk of tooth decay increases. Gum disease. Vaping can cause gum irritation and inflammation, leading to gum disease over time. The chemicals in e-cigarettes can harm the tissues in the mouth, making gums more prone to infection, bleeding, and receding gums. Other oral health problems. The high temperature of the vapor can also cause damage to the sensitive tissues in the mouth, leading to issues like mouth sores, bad breath, and an increased risk of oral cancer due to the presence of toxic chemicals in the vapor. In short, vaping negatively affects your teeth, gums, and overall oral health, leading to potential long term problems. Can dentists tell if I vape? Dentists can often tell if a patient vapes based on certain oral health symptoms, even without the typical tobacco stains seen in cigarette smokers. Dry mouth, also known as xerostomia. Vaping can reduce saliva production, leading to dry mouth, which increases the risk of and tooth decay, bad breath, and oral infections. Saliva is essential for washing away bacteria and food particles, so a lack of it can harm oral health. Gum inflammation. Many frequent vapers show redness, swelling, and irritation in their gums, which are signs of early gum disease. Unlike cigarette smokers, who often have stained teeth from tobacco, vapors may develop gum problems without visible discoloration. Increased sensitivity. Some patients who vape report increased tooth sensitivity, possibly due to the chemicals in e-cigarette vapor irritating oral tissues. Overall, while vaping doesn't leave tobacco stains, dentists can recognize its effects through dry mouth, gum inflammation, and increased sensitivity, all of which can lead to long term oral health issues. What can I replace vaping with? If you want to quit vaping instantly, a pharmacist or stop smoking advisor can recommend a nicotine replacement therapy, also known as NRT product. NRT options. There's patches, provide steady nicotine release. Gum slash lozenges help with cravings. Inhalers slash sprays offer quick nicotine relief. NRT helps reduce withdrawal symptoms like cravings, anxiety, and irritability, making quitting easier. Does vaping affect your sleep? Vaping can disrupt sleep in several ways. Nicotine interferes. Nicotine interference. Nicotine is a stimulant that increases alertness and heart rate, making it harder to fall asleep. Reduce sleep quality. Nicotine affects REM sleep, leading to lighter sleep, more awakenings, and less restorative rest. Withdrawal symptoms. If nicotine levels drop overnight, cravings may cause sleep disturbances and nighttime awakenings. In short, vaping can lead to less sleep and poorer sleep quality, making you feel more tired and restless. Vaping in public doesn't just affect your own health, it also impacts everyone around you. The aerosols from e-cigarettes contain harmful chemicals that can linger in the air, exposing bystanders to substances like nicotine, heavy metals, and volatile organic compounds. This is especially dangerous for children, the elderly, pregnant women, and people with respiratory conditions like asthma. Additionally, vaping indoors contributes to air pollution and leaves residue on furniture and surfaces, creating long term exposures, risks for others. Even if vaping may seem harmless, its effects extend beyond just the person using it. Being mindful and responsible means vaping only in designated areas or private spaces to protect public health. If you're thinking about quitting, now is the best time to take that step towards a healthier future for yourself and those around you. Your choices don't just affect you, they affect everyone around you. Make the responsible decision to keep the air clean, respect others, and protect public health. A healthier world starts with you.